Conditions requiring treatment on the Western Front. Trench fever. Trench fever symptoms included headache, shivering and pain in the joints, which usually lasted 5 days or so. The symptoms could come back. Trench fever also had a number of other names, such as relapsing fever. The medical name for trench fever is pyrexia. Trench fever could be bad enough for a soldier to be declared unfit for duty or to be invalided out of the army. A severe case of trench fever could lead to hospitalisation for a month or more. The fever was spread by lice or greybacks, as some of the soldiers called them. The lice lived in soldiers' clothing and in their bedding, and almost everyone had them. One medical officer inspected 560 men at the Battle of the Somme and found 422 of them had lice. The link between lice and trench fever, however, was not proven until 1918. Trench fever reduced the ability of the British Army to fight, and between July 1917 and July 1918, 15% of men were unfit due to trench fever. The army built bathhouses for the soldiers to use. Men were issued with lice-repellent gel, and some even washed their clothes in paraffin. The army even sent machines to the front to disinfect clothing and bedding. Most soldiers found the best way to remove lice was simply to pick them off by hand. On a soldier's service record, trench fever was recorded as PUO, pyrexia of unknown origin. Rats. Collecting your comrade's dead body could be difficult and risky. As a result, many men were left in no man's land. Rats were a big problem and feasted on the bodies. The rats could be huge. Trench foot. A major problem was trench foot, which caused the soldiers standing around in muddy and waterlogged trenches. This made the soldiers' feet numb, swollen and blistered. Tight boots also restricted blood flow, which made the problem even worse. If a soldier was on duty, they may not have a chance to change their socks or wet boots. Trench foot could even lead to gangrene, and feet or even legs could have to be amputated. Trench foot was made worse by the cold winter of 1914-15. By January 1915, the 27th Division of the British Army had lost 1/6 of its men to trench foot. To reduce the trench foot epidemic, medical officers ordered that every soldier should have 3 pairs of socks, change socks twice a day, and rub whale oil into their feet for protection. Shellshock was first used as a term in 1914. Shellshock was a psychological reaction to the dangers of trench warfare. In late 1916, over 16,000 cases were reported in 6 months. Originally, shellshock cases were evacuated to Britain, but with the 1916 epidemic, the policy of the army changed. Soldiers with shellshock were given rest, food, and talks to calm them. In 1917, medical officers were told not to use the term shellshock and use the term NYD. Instead, this means not yet diagnosed mild. In all, there were 80,000 recorded cases of shellshock. Some men refused to fight and were shot. Gunshot wounds. Artillery shells removed limbs or inflicted major damage onto the body and head, causing rapid blood loss. Machine gun and rifle bullets had the power to break bones as well as piercing vital organs such as the liver and kidney. A soldier who suffered a gunshot wound to the leg in the early days of the war only had a 20% survival rate because of blood loss and infection. 41,000 men had limbs amputated. Many men suffered major blood loss from the impact of shell fragments and bullets. Shell fragments could be very small and hard to find and could carry infection deep into the body. High numbers of men got head injuries, and steel helmets were produced for the soldiers from 1915. Although steel helmets made a major difference, over 60,000 soldiers suffered wounds to the head and eyes. Bullets and shell fragments went deep into the body, carrying dirty clothing fragments and muddy soil, which led to infection. Men that would probably have survived the injury died from infection. As no man's land was farmland, a lot of the soil contained manure, and this made the problem even worse. Also, the length of time a casualty had to lie in no man's land before being rescued also meant that infections had time to develop. One of the worst infections was called gas gangrene. This was caused by bacteria in the soil and developed very quickly. In its early stages, gas gangrene had a sweet smell, and nurses were told to look out for it. Accounts from the time describe wounds that were hugely swollen with gas, turned white, then green, and made a bubbling sensation when pressed. Poison gas. The first use of poison gas was in 1915 at the Second Battle of Ypres, when the Germans used chlorine gas. The gas killed hundreds of soldiers who were unprepared. At the time, soldiers' only protection was to urinate on handkerchiefs and hold them to their noses. However, gas was never that effective as a weapon, as it was difficult to target a particular place and easy to defend against once gas masks were developed. 5% of British soldiers died in gas attacks. If a soldier was poisoned, they would experience coughing, blindness, and a loss of taste and smell. The symptoms might disappear after 2 weeks. Doctors near the front would give soldiers oxygen to reduce breathing problems and wash the skin to remove gas. Large numbers of gas casualties clogged up treatment areas like casualty clearing stations.